Coming up, we'll be on location at Vance Mental Health Services in Waldorf, Maryland, discussing the latest advances in mental health treatment and how they can help you improve your mental well-being, strengthen your relationships, and self-confidence with one of this region's top doctors, Dr. Patricia Vance. Dr. Vance received her doctorate in psychology from the University of Maryland and has over 25 years of experience in community mental health and is widely recognized as one of this region's top mental health experts. Welcome, Dr. Vance. It's a pleasure having you on our program.
Thank you. It's good to be here.
It's your first time, in fact, on the Top Doctors interviews.
Yes.
We have a lot to talk about, and I'd like to begin, if I may, Dr. Vance, by having you tell us what some of the most common conditions are these days that require individual therapy.
Well, I think probably these days aren't all that different from those days, and that the top conditions remain depression and anxiety or some combination of those two.
Oh.
I find that over 50% of our clients have a diagnosis in either depression or anxiety, and when I look at national statistics, that continues to hold true.
Unfortunately, so many people are afflicted with those problems.
Yes.
Very common indeed. And I wanted to ask you, Dr. Vance, what causes these types of problems or conditions to occur?
Several things. Some people are just kind of predisposed through either their genetics or their family history or their social situation to having depression or anxiety. And the stress that they undergo may be what triggers an episode. And we live in a very high stress time, we live in a very high stress area, and people lead very high stress lives. And so situations such as divorce, the loss of a job, the loss of a loved one can be all that it takes to precipitate an episode of anxiety or depression. And then there are some people where it comes out of the blue. There's no particular stressor that's created it, but the stress of their life might get in the way of them having a spontaneous healing.
Yes, and it could have been also, I would imagine, a buildup of various events,
Absolutely.
Various things over time,
Yes.
and suddenly it just hits them,
Absolutely.
in the middle of the night, for example,
Absolutely.
out of nowhere.
We know that stress is cumulative.
Yes.
And over time, people reach a point where they just can't cope in their usual coping ways any longer.
I wanted to ask you, Dr. Vance, what's the evaluation process for diagnosing a patient's specific issues?
In mental health, the evaluation process is a conversation, very much like we're having right now, where the therapist will have specific questions getting at the individual's history, identifying specific symptoms, learning how long those symptoms have been in play, and the degree to which those symptoms impair the person's normal functioning.
And is there a typical candidate that can develop these mental health issues? Let me throw out some examples. Age, gender, is there a higher percentage if you're younger or older or male or female, for example?
Interestingly enough, the highest percentage of people developing these problems tends to be midlife, between about age 30 and 60. Okay, but it can happen at any time, from the very young to the very old.
That I wouldn't have expected. I would have expected maybe as we get a bit older in life, where that percentage would be higher, but you're saying right around midlife, basically, on average.
And it may have to do with the stress level.
That's
true.
I
mean, somebody who's 40 years old is typically juggling a career, young children, elderly parents, the commute, maybe financial strain. There's just a lot going on at that time, and people's resources become very taxed.
That's a very good point indeed. Now, what would you say, Dr. Vance, are some of the most effective strategies or therapies available that can help folks with these issues?
We know that talk therapy does work, and talk therapy comes in many different formats and very many different styles, just like therapists come in very different styles. The research tells us that the quality of the relationship between the therapist and the patient is the most important variable for the patient being able to work through their problems. And that's why it's so important for a patient to feel very comfortable with his or her therapist.
Yeah.
And if after a couple of sessions they're not feeling comfortable, they really do need to shop around, and it's okay. Therapists understand that. Nobody takes that personally. In terms of specific therapeutic style, cognitive therapy seems to work very well for many depressions. Having one feel supported and cared about, and helping a person learn new strategies for dealing with problems are also important. So we have ego supportive therapies, we have psychoeducational therapy, relationship therapy. These are all important therapies, and most of us use pieces of all of these things.
Sure.
Depending on the individual, where they happen to be in their therapy, and their particular needs at that particular moment.
What type of results are you seeing in your patients from the various therapies that you're offering?
Results have a lot to do with the individual patient, as you can imagine, and with their life circumstance. So somebody who comes into therapy because of a very bitter and contested divorce, and that has created a lot of anxiety and a lot of depression, may have a difficult time managing the anxiety and depression as long as the contested divorce continues.
Yes, that's a great point. You're right.
So, and in those situations, we're helping the person with coping skills, thinking about strategies, trying to manage it, helping them try to take a little bit more control in their life, so they're feeling like they're more a change agent rather than having things done to them.
Sure.
But it's still a struggle, and they're likely to need some ongoing support.
Yes.
Somebody who's had the anticipated but still painful loss of, say, a parent, may come into therapy, but may only need a handful of sessions as they come to terms with their grief, kind of reorganize their life and move on.
Yeah.
And so it depends on what the stressor is that brings them in, the nature of the disorder that they're coming with, and how long that stressor may be lasting for them.
And what I love about your approach here at Vance Mental Health is that you really, from what you've told us here so far today, Dr. Vance, utilize a customized an effective therapy approach, treatment approach, and plan for each individual patient based on his or her needs and their situation.
Absolutely.
To really optimize the results that patients are experiencing by coming to you.
Yeah, there is no such thing as an effective cookie cutter approach.
That's right.
Everybody's different.
Dr. Vance, we are literally out of time, but I wanted to ask you, before I let you go, you and your practice, Vance Mental Health here in Waldorf, Maryland, have certainly established a reputation for excellence. Not only are you one of this region's top mental health experts, but your practice has an excellent reputation in patient care as well, between you and your staff. I wanted to ask you what you feel help separate you and your practice apart from some of the others?
Well, I've thought about that, and I have to say there are two things that come to mind.
Okay.
One is that I had over 25 years in the public sector. My partner here in this setting, likewise, and many of the other therapists who work here had years of experience in the public sector. So we have a very in-depth experience working with mental health issues, which we bring here to this setting. And so I think what sets us apart really is the breadth and the depth of our experience.
Yes, indeed. And it's not just you and your partners here, but it's also your staff. The patients love you all. From everyone at this practice, you really seem, and our research has backed that up, to go, and I hate using cliches, but I think it really is very true in this case, that you and your staff really treat the patients as if you treat others like we would want to be treated.
I hope so.
And it really speaks for itself. And on that note, I would like to thank you, Dr. Vance, for joining us, being a guest in our program and educating us. We'd love to have you back on in the future.
Thank you so much.
Thank
I'd love
you.
to be back.